or even better.
People living with hearing impairment in Embu through the Deaf Empowerment Society of Kenya have started an engagement with stakeholders in the healthcare profession in a bid to sort challenges they face while looking for health services. Speaking at a workshop in Embu, they observed that many are not comfortable when explaining issues of reproductive health to healthcare professionals through an interpreter. They're now calling for the health professionals to get sign language lessons to bridge the gap and ensure privacy.
As doctors, basic sign language among us. We only want basic. We fail on that. If the interpreters are working well, then the deaf community will be happy. Because most of the information, when they go with the interpreters and the deaf people in the hospital, the information will be all over.
Doctors and nurses, they need to learn Kenya Sign Language so that they can communicate to expectant women who are deaf. Sometimes the deaf people communicate using the village gestures. They say maybe they use a language that a doctor will think that it's not good and they start laughing at them. The attitude, negative attitude.
I would like to urge our government, both the county and the national government, to come in and partner with the organization like Deaf Empowerment Society of Kenya, so that we can train more healthcare workers on the sign languages.
The research has shown that many people all over Kenya with disabilities face a lot of challenges because of the lack of interpreters in hospitals and the lack of easy to understand messages in hospitals, and the communication barrier, which is the biggest issue in accessing healthcare services, especially SRHR services.
Rice farmers in Kwale County living in Lunga Lunga have received